Hey everybody out there on Medicare, Christian Brindle here, owner and operator of Christian Brindle Insurance Services, also known as Everything Senior Insurance, and we are at that time again of the year where we're at the Medicare annual election period where all of the Medicare plans, Medicare Advantage plans meaning, and Part D standalone prescription drug plans are going through some changes and some shifts. And every year we get questions about how should you accurately and efficiently go about managing and maneuvering the Medicare annual election period, right? It's a time of the year where all types of advertising is going rampant, right? You're seeing TV commercials, you're seeing things on social media, your mailbox is so full it's about to explode, and everything else in between. And it's enough to make you feel a little bit overwhelmed and confused. So in this video today, what I'm going to do is I'm going to walk through with you exactly what you need to know about the Medicare annual election period and how you can best go about navigating it as a Medicare beneficiary and knowing if your plan is going to be the best one for you or if you should make a change. Now in 2025, what we're seeing is there's a lot of plans that are going through a lot of shifts and changes over the course of the season, taking effect January 1st, 2025. The reason for this is because of the Medicare impacts that are taking effect in the Inflation Reduction Act. We've made several videos on this channel. If you have not seen those videos yet on kind of what that impact is, go back and kind of watch those videos. We'll try to link them either in the description or somewhere above, so that way you can kind of take a look at them if you're kind of curious about that. But what we're seeing is a lot of plans are going through some changes, right? For the majority of plans, they're pulling back benefits in a lot of areas, right? Maybe the dental benefits are being cut. Maybe the medical benefits are being cut. Maybe the network is shrinking and they're dropping providers out of the network. Maybe their formulary is changing, maybe they're adding large prescription drug deductibles, but what we can be assured of is the vast majority of plans that we've seen so far this open season are going through a lot of changes. So here's how you can navigate these changes and know what's best for you, okay? So the first thing I kind of want to kind of cover with you, with everyone, is your ANOC document, okay? This is your annual notice of change document. By the time you're actually watching this video, you should have received in the mail or electronically, if you elect for electronic delivery from your different insurance companies, but you should have received this in some way, shape, or form from your insurance company that kind of goes over and documents what's changing from 2024 to 2025. What it's designed to do is to show you your plan from a 10,000-foot view, side by side, 2024 on the left-hand side, 2025 on the right-hand side, and kind of showing what's changing. Now, the document is not perfect. It's not going to show you everything. Typically, it does leave a lot of things off if there are benefits that are staying the same and not changing, although some benefits that are commonly discussed, like doctor copays, hospital copays, max out-of-pockets, etc., even if they're not changing and they're staying the same, a lot of times those things will still be listed even if they're staying the same. But typically, for the most part, the annual notice of change document is designed to show you what's changing from this year to next year. So if you haven't gotten that document yet, reach out to your various insurance companies, find out where it is, see if they can get you an electronic copy immediately, because this is something that you want to have in your hands and you want to be reviewing so you can get a good idea of what the full picture is for 2025. Now, once you've kind of gone through and reviewed your document, you can get a pretty good idea of knowing what your plan is looking like for next year. Is it strengthening? Is it weakening? Most plans on the Medicare Advantage side are weakening for 2025. Now, if you're on a Medicare supplement plan, you might get an ANOC document for your standalone prescription drug plan, but you will not get one for your Medicare supplement plan. People ask me all the time, why is that, Christian? The long and short of it is, Medicare supplement plans do not ever change their benefits because of open enrollment period. Okay? Because they're not changing, there's no need for an annual notice of change document. In fact, annual election period has absolutely nothing to do with Medicare supplement plans. With Medicare supplement plans, you can change them any time of the year that you like, as long as you can pass health questions or underwriting, unless you live in a birthday rule state like California, Colorado, or one of these other birthday rule states that let you change every year without health questions in the month of your birthday. But your annual notice of change document is very important. So that is the first step in reviewing it and getting a good feel for what your plan is actually going to look like for 2025. Now, the next step that I want you to be thinking about is understanding the various dates that come with the annual election period and what the significance of them are. Because there are a lot of dates, they all have different meanings, and there's different times for when things are being either released or when you can make a change. So let's kind of walk through them and kind of explore these dates together. So the first date you need to be aware of is 10/1. By the time you've actually seen this video, 10/1 is already passed, right? But 10/1 is important for this reason that all Medicare plan changes on the Medicare Advantage and standalone drug plan side are made public to everyone starting October 1st. It's when all of the information is public, right? It's when new prescription drug plans can be ran in terms of comparisons and seeing what your prescription costs are going to look like for the next year. It's when you can actually go online and find all of the various plan changes, and it's when all of the different insurance agents and various insurance professionals can have access to all of the information across the board on all the plans. So all the plan changes go public October 1st, and then come October 15th is when you can actually make a change. So people always think, October 1st is when the real craziness of open enrollment begins for Medicare, right? It's when you can actually make a change. It's when all the benefits are changing, and that is not the case, right? So changes come out October 1st, but then once the changes come out, you can't actually enroll into any plan for the new year if you wanted to change something till October 15th. Then from October 15th through December 7th are the time periods. Those are that's the dates that you can essentially make a change. So you can make a change from October 15th through December 7th, and that new plan that you enroll into, if you do elect to make a change, will kick in January 1st of the new calendar year. Now, there's also a time period that's quarter one of the new year. They call this the OEP period, the open enrollment period. And I'll explain in a second why I'm talking about this, but basically what this means is if you're on a Medicare Advantage plan already, come January 1st, from January 1st to March 31st, you are allowed to change your Medicare Advantage plan one time to either another Medicare Advantage plan or to original Medicare with a standalone prescription drug plan if you so choose to do so. Okay? Now the reason why this matters is because a lot of times people are afraid of trying out a new plan if they've been on a plan for a long time and then maybe it looks like it's getting worse and they want to try out a new plan. This time period gives you the ability to sign up for another plan during this time from October 15th through December 7th. And then if you don't like it, this time period can almost be looked at as a trial period for you to where you can either switch back to your old plan or you can change to a new plan entirely, okay? So that's another time that you can change. But just be aware, you're granted one change during this quarter one open enrollment period, okay? Now, with that being said, how do you accurately check your plan? Well, the best way to do this is having an advocate, right? Having an insurance agent that actually is assigned to your account, that is independent, that works with a multitude of different insurance companies and specializes in working with Medicare beneficiaries, right? That's what my company does at Christian Brindle Insurance Services, also known as Everything Senior Insurance, right? That's what we do and that's what we specialize in. That's what our team is trained for, and that's what our operation is completely set up to do, right? So that definitely gives you a shortcut. But if you're hell-bent on doing it on your own, the best things you want to keep in mind if you have a Medicare Advantage plan is understanding if your prescriptions are covered well for the new year. Now, this year in particular, there's more prescription changes on a lot of plans than we've seen in a decade because of the Inflation Reduction Act changes. So you'll want to run an updated prescription drug comparison. Now, it's easy to do this with an agent. An agent can do this for you for free at no cost and no obligation to you. At the very least, they can just have the information. But if you are hell-bent on doing it on your own, the best place to do it is on Medicare.gov. It is a little challenging, a little tricky to maneuver for most people. But your prescriptions and making sure that they're in order is probably the first thing you want to start with. The next thing you want to look at is, are your doctors covered in the network for the new plan year? Now, it's not super common that plans, dramatically change their networks for upcoming years, but it does happen in every year that we go into in certain areas where a hospital system was contracted with a various insurance company. It might fall out of the network for the new year. Or a specific clinic or a doctor's contract with an insurance company and they don't renew their contract for the new year. So checking your doctors and making sure that they're going to be still in the network for 2025 is vital. And then last but not least, looking at your overall benefits, right? What does your benefit look like? What is your max out of pocket? What is your copay for a specialist? What is your copay to spend the night in the hospital? What is your dental benefit? What is your over-the-counter item essential benefit? What are all these benefits and then looking at the whole totality of the picture, right? Your prescription costs, whether your doctors are covered or not, and your overall benefits, kind of taking all of these things and kind of ordering them in terms of what the highest priority is for you is key and pivotal to selecting and understanding what your best Medicare health plan option is going to be. Now, this time of the year, right, as I mentioned a second ago, advertising is rampant. Advertising is rampant, and there's so much going on. Everybody wants a piece of you during the annual election period. Everybody wants to be your best friend during the annual election period. The best thing I can tell you, right, is if you don't have an agent, it's a great time to get one. An agent is a free advocate to you. It does not cost you a penny to work with a licensed insurance agent on your Medicare health plan. So it's definitely in your best interest to take advantage of that. My organization works with people in 45 different states. So you're more than welcome to call us, and I'll give our number in a second, and our number's also down in the description of this video. But even if you just wanted somebody local to you in your area, finding a local insurance advocate is the best thing you can do because it takes all of the guessing work out of it for you. It also prevents you from having to do hours and hours and hours of research to be able to determine if your plan is still sufficient for you or not. Now, understand this during the annual election period, right? Every year, there's situations where people are on a good plan and they get, talked into another plan, right? You got to be careful of that type of thing. Make sure that you can see things in writing. Make sure that you're working with somebody that you trust, and make sure you're working with somebody that is knowledgeable, right? That knows what the hell they're talking about this stuff. It's very important because this stuff is complicated. If it's complicated for you, I promise it's complicated to a lot of other people that are even licensed as insurance agents, right? So you got to work with a competent individual that has integrity. And then last but not least, you want to work with somebody that can offer you a multitude of different options so that way they're not biased, right? You want to make sure that you're not working with somebody that just has one or two different insurance companies. I've always advocated against working with somebody that Medicare is like a secondary focus for them, right? Maybe they're a financial planner, maybe they're a CPA, they try to do Medicare as well. They're just not going to have the knowledge of a true specialist with something as complex as Medicare. So make sure that you have a true advocate and make sure that they're going through with you the combination of everything we talked about here today on what's going to be important to you. Prescription costs, doctor availability, and overall plan benefits on kind of all sorted into one. And the priorities of those, which ones are most important in order to least important, is going to vary based on your specific needs and preferences. But nobody is the same. No two situations are the same. So you need to make sure that a plan is individually selected for you. As long as you take this advice, as long as you follow this step by step, you'll have no problem in navigating the Medicare annual election period. I hope you found this video helpful. If you did, please do me a favor, smash the like button for the YouTube algorithm. It's going to help so many more people just like you find this video who desperately need to hear this information. Do me a favor also, comment your thoughts down below. As you feel like there's anything I missed, I'd love to have a dialogue with you about it. What did you think about kind of what I talked about in this video? Let's have a conversation in the comments. Also subscribe. We put out weekly videos to help you with your Medicare, and we're going to help you out and give you information you need to be aware of to get you through this Medicare annual election period season. Thanks so much for watching, everybody. We'll see you next time. Christian Brindle out. Reach out to our organization at 801-255-5340. Again, 801-255-5340 for a free, no obligation consultation. We're licensed in 45 states. One of our team members is happy to assist you, and we'll see you next time, everybody. Happy Medicare.